Assalamu alaikum. This is Dr. Sitwat with another lecture of dermatology. Today we are going to do the cutaneous viral and fungal infections. वैसे तो बहुत सारी infections होते हैं जो कि skin को affect करते हैं, but today we will deal with only those that affect skin directly or wholly. उससे पहले we have to know a little bit about the different types of viruses, the DNA virus and the RNA viruses. Now, DNA virus में important is orthopox virus जिसमें वेरियोला वैक्सीनिया आता है। उसके अलावा हर्पीज वायराइडी सबसे इंपॉर्टेंट है, सिंप्लेक्स वायरस जिससे हर्पीज सिंप्लेक्स होता है। उसके अलावा वेरिसिला जोस्टर वायरस, साइटोमेगैलो वायरस, पेपिलोमा वायरस जिससे वॉर्ड्स होते हैं, वेरी इंपॉर्टेंट टू फॉर द इन्फेक्शंस फॉर सेकेंडरी मेलिग्नेंसीज। देन हेपेटना वायरस causes hepatitis B, उसमें associated skin की findings मिल सकती हैं। RNA viruses, retroviruses जो कि HIV cause करते हैं। Then the flaviviridae, hepatitis C, dengue fever cause करते हैं। उसके अलावा RNA viruses single stranded वाले, उसमें paramyxoviruses है जिसमें morbili virus है which causes measles, rubella virus which causes mumps, but that is not related to us actually क्योंकि उसके अंदर skin की कोई findings नहीं होती। Important group that we have to consider is the herpes group of viruses. HSV1 causes primary herpetic gingival HSV2 causes the genital herpes. Varicella zoster virus causes varicella or chickenpox in the primary infection, and in the reactivation causes zoster, herpes zoster, which is shingles. Then there are other cytomegalovirus, EBV, herpes humanus virus 6 and 7, and herpes virus 8, which is associated with the Kaposi sarcoma. Then different types of rashes that are present in viral infections: macular rash, maculopapular rash, maculopapulovesicular rash, then maculopapulopetechial rash, urticarial, vesicular, and so on. Now, viral, important that are included in your syllabus are chickenpox, herpes zoster, measles, herpes simplex, molluscum, and viral warts. Chickenpox, caused by varicella zoster virus, it has a mild prodrome, like a bit of body aches and mild fever, but actual is the morphology of the lesions. Starts with macule, which changes to papules, to vesicles, to pustules. And dewdrop on petal appearance is the typical feature of the pustule that occurs in chickenpox. The distribution is centripetal and the spread is centrifugal. That is, it starts in the center on the usually abdomen and trunk and spreads centrifugally to the face and the limbs. Lesions are seen at different stages in same person because it has multiple crops. Labs, Zank smear. Zank smear is a test which checks the viruses. इसमें जो vesicle बनता है, उसमें से थोड़ी सी scrapping लेके उसको microscope के नीचे देखा जाता है, तो you see the virus. Other than that, you can do the viral culture and the PCR. Treatment is basically supportive, especially in children, because ये हो जाता है. Antivirals like acyclovir, famciclovir are given in adults because chickenpox in adults is usually severe. This is a picture of a complete picture of chickenpox. You can see the different types of lesions present in the baby: crusting, ulceration, erosion, and if you enlarge, you can see a papule, a blister, which is the typical dewdrop on petal appearance, and an ulcer all in one go. Then herpes zoster. If the virus of herpes, varicella zoster virus of chickenpox becomes dormant in a dorsal root ganglion, may become, after decades, may increase, may become awakened or stimulated by advancing age or decreasing immunity, and it may result in herpes zoster now and will affect only the nerve root where it was dormant, not the other parts of the body, unlike chickenpox. And usually it's self-limited dermatomal rash, but it has severe pain and it can be far more serious. In addition, the acute cases often lead to post-herpetic neuralgia, which is the pain and is responsible for a significant economic burden. This is picture. First one shows the cervical. The second is thoracic. The third is also thoracic, and the fourth is lumbar. You can see only one dermatome is involved. So the papulo-vesiculo-pustular lesions are present only in that particular dermatome and nowhere else on the body. Then measles, caused by myxovirus. Prodrome is very prominent. Enanthem occurs. What is enanthem? Any lesion which is present on the mucosa is enanthem. And whatever is present, the rash that is present on the skin that we call a rash is exanthem. Enanthem is complex spot opposite the premolar tooth. Exanthem is centrifugal opposite to chickenpox. The lesions start centrifugally, usually behind the ears, on the forehead or the limbs, and then they spread centripetally to involve the abdomen or trunk. Maculopapular rash fades with brownish coloration. Only one crop is present at one time, so it's a monomorphic type of reaction. Complications. When the prodrome is severe, complications are severe. Ear infections, diarrhea, pneumonia, even encephalitis. Diagnosis, IgM positive, IgG for the past infection and immunity. You can diagnose by throat, your nasal swab, and viral DNA. Treatment is again supportive. Passive protection is by the EPI. Complex spots and the monomorphic picture. Compare it with the picture of the child having chickenpox. He had multiple crops, so different types of lesions all present simultaneously. Herpes simplex, caused by herpes simplex 1 causes the herpes labialis when it affects the lips, and oral herpes when it causes the oral involvement. When it is labialis, there are vesicles present which are usually not ruptured. But when there is oral herpes, obviously within the mouth, intact vesicles cannot stay like that. They become ulcer and become painful. Then molluscum contagiosum, caused by molluscum less than 5 years of age usually. Small, rounded, pearly white with a central depression or called as punctum. It may occur on face, neck, chest, and usually, since being viral, they clear by themselves, but not as commonly as viral fever as happens that we say, "Arey, 4-5 दिन में ठीक हो जाएगा." This takes 1 to 1.5 years to go. Viral warts, caused by human papilloma virus, again self-limiting, being a viral infection, and like molluscum in 1.5 to 2 years. Caused by spread by direct contact, and some of the viral warts types, which are more than 30, have oncogenic potential. Types, common warts, multiple hyperkeratotic. Koebner phenomenon is positive. Koebner phenomenon is that there are certain skin diseases which, if a trauma occurs on a normal part of those patients, that particular disease which the patient is harboring will result in development of the similar lesions of the actual disease. Koebner phenomenon. Then the plantar warts, 1 and 3, human papillomavirus, constant pressure on the soles, nerve pressure causes pain. Plain warts, face and back of hands, genital warts, uncommon, but if present, consider abuse. Then this is the picture of the warts. Fungal infections of the skin, we come on to the second part of the topic, and superficial or mucocutaneous dermatophytes, tinea, candida, pityriasis versicolor in the course in your syllabus. Then the subcutaneous variety which occur under the skin, sporotrichosis, chromoblastomycosis, eumycetoma. Deep mycosis, which are deep or systemic infections, that is inside other organs of the body. Histoplasmosis, blastomycosis, aspergillosis, invasive candida. Candida can cause all 3 forms: mucormycosis, cryptococcosis, pneumocystis, pneumonia. Then fungal infections. Pityriasis versicolor is caused by Malassezia species. Discrete lesions are present, discolored on upper trunk. Usually occurs in adolescents. Coppery orange fluorescence under Wood's light. Diagnosis is by sticky tape scaling, that is Brany scales occur. Diagnosis is by sticky tape scaling, fungal scrapping with 10% KOH. You can see the hyphae of the lesions, and if you take a biopsy of the lesion, you will see spaghetti and meatball appearance of the spaghetti like the hyphae, and the meatball are basically the mycelium of the hyphae. This is a picture of the pityriasis versicolor, which shows the hypo or hyperpigmented. In the dark skin, it is hypopigmented lesions, and in the hyperpigmented, it is in the hyperpigmented, it is hypopigmented lesions, opposite. It's not basically a variety of colors, it is basically just two colors. Then dermatophytosis. Keratin destruction, inflammatory host response. This causes the dermatophytes. Tinea corporis. Now, different parts of the body have different names, otherwise the lesions are usually similar. Annular lesion, which is the typical lesion of the tinea or the ringworm lesion. Tinea capitis, invasion of the hair shaft. It has four different types. The gray patch with the broken off hair, so it's basically coated with arthrospores, and this gives it the typical appearance of the fungal infection. Then chirion, severe painful mass, matting of plaques. It basically looks like a bacterial infection. It is so matted and bogey swelling. These are the different organisms that cause it. That is, the gray patch is usually caused by the ectothrix type, the Mycosporum ordinae and canis. Chirion is caused by Trichophyton verrucosum, and this is zoophilic in nature. Black dot, broken hair at the scalp surface, caused by Trichophyton violation, and it's an endothrix type. Favus, yellow scutula are present, yellow crustings caused by Trichophyton schondleni. Now you see the pictures of all these. This is the typical tinea corporis. The boy has tinea corporis as well as tinea faciae. If you can see on the face, he has a similar lesion, but being on the face, it is called as tinea faciae. In children and females, it is called as faciae, but if it occurs in adult male, it is called as tinea barbae. Then it is also centrifugal in spread. There's a small papule that begins and it spreads centrifugally. The organism is present in the active border and not in the center. Now, the first picture is of chirion. Then you can see the appearance is very pustular type, like it's a bacterial infection. The second is a large alopecia patch with coating grayish appearance, that is the gray patch. Then the third one with A and B pictures is the Trichophyton schondleni causing favus. You can see the scutula, the yellow colored hard crusted lesions like flower petals. And the fourth one is black dot. You can see the black dots. And what are these black dots? These are broken off hair actually, which are present under the surface, but they were so weakened by the presence of the fungus that they could not grow outside the skin. So there is no shaft. Tinea faciae increases after sun exposure. Tinea pedis occurring on the feet, more than 6 years of age. Peeling, maceration, fissure, dry, or vesicular bullous lesions. There are three phases. Either the spectrum is of dry type or the wet type and an intermediate type. Tinea cruris, when these plaques occur with sharp margin from the groin to the thighs, it's called as tinea cruris. Again, it's the same thing as tinea corporis, except the difference that tinea corporis is more scaly, whereas tinea cruris being in the potential body fold, it is more macerated and there is more erythema and less scaling. Treatment, terbinafine, itraconazole, fluconazole, all these are available. Then candidiasis. Candidiasis, as we all know since the beginning of medical college, oral thrush, very common. White pseudomembrane present in the mouth area, usually in children, but even in adults, like insane people, Alzheimer's patients, comatose patients, CVA patients who cannot look after the hygiene of their mouth. Nystatin drops are good for that. The predisposing conditions are, I just told you, that patients are not able to look after the hygiene. So they develop oral candidiasis. Then napkin and cutaneous candidiasis, subcorneal pustules. The lesion is exactly like that of tinea corporis, but there may be satellite pustules present. Like, you can see the difference. You can see the difference in, if you remember the tinea on the child, it was a clear lesion. In this, the lesion is not clear and you can see small pustules like satellites around the Earth. These are the satellite pustules which confirm that this is not a simple fungal infection, it is a candida infection. So we treat it accordingly. And this is the oral thrush that we all know already, right? So this was a little about the fungal and viral infections that commonly present to skin OPD. There are many other infections, but these are included in your syllabus. So we will just stick to these. And if you have any queries, you can always come to me or repeat my lecture and here again. Thank you.